Our topic is business model innovation, which is a hot topic across industries. I have come to believe that business model innovation is in fact a core competency needed at every company today, and it didn't used to be. Because it used to be that a good business model could last for 10 years or 20 or 30, and in some cases even more. It's not the case anymore. And even if you find what the next one is, it's not going to last 10 or 20 or 30 years. And yet most businesses don't have that competency because they haven't had to have it. Now every business needs it. What's of particular interest in healthcare, for starters, is that on the whole, it has probably been slower at business model innovation than other industries. Vel, we'll start with you, but in your experience, why is that so?
Yeah, it's true. I mean, if you look at the traditional model, you've got suppliers that are very focused on the product, and you've got providers on the other end, very focused on business and patient outcomes. So what do suppliers like to do? They like to make, sell, and ship, and then they hand off the product and they leave it to the provider to own it, to operate it, and to get business outcomes. So there are two reasons why I think healthcare is a little slow to adapt. Providers are very concerned about security. They're very concerned about privacy, siloed data. You can, the fear of a change in the business model, whereas suppliers, they've been operating under this great business model for many years, and that business model is still going pretty well, right? So why change? I think if you look at those two areas, it makes sense why it's a little slow, but neither one is sufficient. It's every other industry has succumbed to these changes, and healthcare is no different. It's just a matter of time.
Right. It will have to happen.
Absolutely.
Yeah, Lori, what's your view on the same question?
Yeah. So, traditionally healthcare has been driven through volume-based care as opposed to value-based care. And you're starting to see the shift happen, right? So when we started out in the volume-based care, we optimized ourselves for transactions on the supplier side, on the provider side. And so everything, our economic ways of working, our financial models, our ways that we sell and talk to each other, it all is very fine-tuned for what we'll call more of a transactional model. And now with the shift, we need to make some changes in our business models in order to get to that value-based care. So it's really all about, hey, where we came from, and that worked, but as we go towards more of a value-based, we have to shift with it.
Right. And what's becoming, we will get to that, but what's becoming clear from what you say is that in this industry, a given institution really will have a hard time changing its business model on its own.
That's correct.
Right? Many others have to be involved, and maybe that's part of the reason it has not happened as fast here.
Yes.
Yeah.
I totally agree. So if you look at how you're going to deliver value-based care, no one group, the providers can't do it alone, the payers can't do it alone, the patients can't do it alone, and the suppliers can't do it alone.
Right.
And when you have to have that full end-to-end ecosystem working together in order to make the shift, it's difficult, it's hard, the transformation's hard, because none of the ways of our doing business was ever set up to be able to say, hey, we got to all work together, we got to all align together, we have to be in this, for the same purposes and the same focus. And when you have to make that shift, everybody, you still need to perform, right? You can't just stop and say, let me stop everything, make it all from scratch, and have a fully aligned system end to end. We really need to take a step back and go, okay, we still need to perform today, but now we have to slowly gravitate towards these new ways of working, and we have to have that alignment amongst each other. So it's difficult. It's not an easy task for anybody, and everybody's going through it together. So.
Yeah. Okay, well, if that's the situation, then we got to look at the incentives for everybody in the chain. Right, so let's start with suppliers. Why should suppliers care about this? Why should the CEO or the CIO, CFO lie awake at night thinking about this?
Yeah, so, when you look at suppliers, there's two mega trends that are happening in the industry today, right? Number one is feature functionality is being commoditized. I mean, at the end of the day, customers really don't care about the features anymore. What they only care about your product to the extent that it helps them achieve their business outcome or improve patient outcomes.
Right.
The second thing is there's changes in how they consume that technology, right? It starts to move towards the area of I only want to pay for what I consume. So if you're a supplier and you have those two things looking you in the face each and every day,
right.
you know, what starts to happen is the old model begins to disappear, right? You don't have a product sale.
Right.
You don't have product attached services to put to that product sale, and they may not refresh the technology that often, right? So if you don't fill that white space in between your product and what the customer or the provider is looking for, you're in trouble. Whoever fills that white space is going to be in the best seat.
We're moving to everything as a service.
Exactly.
Is that it?
Yeah.
Yep. Okay.
Yeah, and X as a service, technology as a service, and
Right.
it's more than a lease.
Right.
It's not a lease. It's actually how do you help?
Right.
How do you help achieve the outcome?
Right. Why should providers lie awake thinking about this?
Well, so I'm on the supplier side, so but providers, it's really important that they really think about this, because if they're really, right now the cost of care is just out of control, right? We know it's not sustainable. We know that we can't keep going the way we have been, and you know, the definition of insanity is to keep doing the same thing over and over again and expect a different outcome. And so providers really need to take a step back and say, okay, if I need to really ensure that I have to bring down the cost, I have to have better outcomes, I still need to ensure that there's patient satisfaction and that there's clinician and care team satisfaction. What do I need to solve those problems? And I need to work together with everybody in the healthcare ecosystem to do that. And so for them, it's a survival, right?
Right.
You see hospitals going out of business left and right. You see consolidation happening because everybody can't do it alone anymore. Right. And you see collaboration becoming much more a prevalent way of working, and care teams really saying, hey, it's not about our siloed ways of working anymore. It's not about just handoffs for the sake of handoffs. It's how do we actually work together? How do we standardize on the ways of working? And how do we really get those better outcomes at a lower cost?
And,
right.
you know, Lori, just to add to that, right? I don't see how any provider can hit the quadruple aim
right.
on their own, right? The technology's changing way too fast. They lack the skill sets. Like you've heard many times, everybody's a tech company today.
Right.
And if everybody's a tech company, it's tough to recruit those people, to get them in, you know, to make that work. And it's I don't know, does anybody here have too much capital? I don't think so, right? So capital starts to dry up, and you're going to need new business models in order to achieve the quadruple aim. So if you put together technology skills, the drying up of capital, providers should be very concerned about this shift as well. I see it more of an opportunity from their perspective.
Yep. And I mean, Lori, as you mentioned a minute ago, you're from a supplier perspective also. If you look at it from that perspective, what should we add?
Yeah, no, I think Val said it very well. As a supplier, you know, we're at just as much a challenge with the number of resources we have and how to do more with less, right? The same thing holds on the provider side, same thing holds on the payer side. And so if we can really start aligning together and start really trying to solve those problems together, I think we're all going to be in a better situation and really be able to solve these problems that we couldn't solve in a pure capital model where we didn't have shared KPIs, we weren't sharing in exactly what at risk what each one needs, and so by collaborating, we're really going to have a much better chance of success.
Yeah. I'm going to invite comments and questions in just a second, but I want to ask both of you, okay, well, you make a compelling case. What starts the process? In other words, somebody's got to pick up the phone and talk to somebody else in terms that will incentivize the somebody else to get involved.
I'll take that as a start, right?
Yeah.
Because we've tracked industrial equipment companies, enterprise IT companies going through this transformation.
Yeah.
And I will tell you that every supplier in every one of those industries had to get dragged in, kicking and screaming into this new business model, right? Because the old model, the old model was great. Make, sell, ship. I get paid. I move on to the next one, right? So to me, I think it's incumbent upon the providers to recognize that change and to say, hey, this is what we have to do in order to achieve that quadruple aim. There's no way we can do it, and they have to beat the drum. That's our perspective.
Right.
I think it's a partnership because I think, yes, there has to be the pull model or the push model of providers pushing the suppliers to the new model.
Right.
But as a supplier, it's incumbent on us to also create that innovation to help make it work, that partnership really work. You know, we've started to see that a number of our customers want to have more long-term strategic partnerships.
Right.
But the basis of that is still more on that I'll give you the long-term partnership if you give me the pricing of your equipment at a lower cost, right? So we've started down the path, and maybe there's some services that we add to it, but it's only the first step. What we haven't really done is really take a step back and say, you know what, you have challenges as a provider. What are your challenges?
Right.
What are your KPIs that you need to measure
Right.
to solve those challenges? What if we actually shared in those KPIs and we both had a skin in the game to actually solve those problems? What if we were talking together and saying, hey, you know, a lot of times when we look at what are the problems, we solve symptoms. We don't really get at the essence of the root cause. And it's because we're all looking at it from our own little siloed version of why do we have the problem to begin with. And so, you know, if we took a step back, we worked together as true partners, we really said, what are the problems, what are the KPIs, what are the root causes, and then together we share in the enabling ways of working, I think we would be in a much better shape than we are today. Technology alone won't solve problems. If we just bring something into you and say, you know, here it is, this will solve all your problems, and we walk away, I have never seen it work. Yeah, the basic installation and knobology and stuff, that works fine. But when you want to consume really and take advantage of what we put out there, a lot of times the consumption gap gets very big. And a perfect example of this is education. I don't know how many times I go to customers, and when we're having the discussions about what do they want to buy, the first thing that seems to want to go, because everybody's talking about price, is education. Yes, we'll do education just to get it installed and deployed. What happens after that?
Right.
Well, what happens after that is nobody asks us to come back. There's no baselining to see where you are at today. There's no way to see if there's any improvements based upon what you just bought. There's no way to say standardize and make sure that everybody's doing things in a best practice way. If you don't standardize, you can't optimize. If you don't optimize, then the value just doesn't come. And if you don't then repeat and rinse that continuous improvement process, we're never really going to get the true value out of what we deliver. And so to do that, that ecosystem has to work together. We need seats at the table. We need to be a partner. We need to have those discussions, and we need to be in it together.
I think you just hit on, you know, the key components of what a good partner looks like, right? Because whenever you do this transformation, you're going to have customers at every end of the spectrum.
Right.
And you know, some of those customers are ready to go. Other ones, they're still very transactional, right? So you have to have a partner that considers you strategic, has a history of listening to your recommendations, has the process capability to execute against the implementation, and is willing to share KPIs, right?
Exactly.
If you don't have those four, then you really don't have a partnership, and you may want to think about, you know, make, sell, ship, and move on instead of like I'm gonna deliver an as a service offer.
Yeah, and I think there's phases to this. You know, you're going to start out with the customer who's very transactional, but you don't necessarily have to jump right into the value-based care. You know, maybe it's that step of, hey, let's have a longer-term partnership. Let's, you know, say that we're in it together for for the long haul, and then slowly start building up those services, slowly start trusting each other that we can help each other, slowly start sharing those KPIs, and knowing that both sides have to come to the table, both sides have to make compromises, both sides though in the end will together really help us get to that true value-based care and those better outcomes, which is at lower cost, which is what we're all looking for.
That's the goal.